So first of all, I want to congratulate the authors because this is a very interesting study, but compound, okay? So I'm going to start with that. So I think it's an immunomodulatory vaccine. So differently from the, for example, personalized vaccines, if mRNA or peptide, those personalized, they target that specific tumor from that specific patient, right? We have the vaccines that target to the tumor specific antigens, but differently from all this one, it will modulate the tumor microenvironment because it's going to target any cell, tumor and non-tumor cells, so immunosuppressive cells that express a specific marker. In this case was IDO1 and PD-L1, okay? So that's the first thing I want to highlight. The second thing is, this is a first line, so untreated patients, okay? Of course, patients who had neoadjuvant or adjuvant treatment could be included as far as the time between finishing the adjuvant and neoadjuvant and starting this trial was 6 months, okay? But keeping this in mind, this is first line, it was the vaccine plus pembro versus pembro, okay? So that's one thing. So the trial was not positive, okay? In a sense that, but literally was by a little bit that it missed, okay? And then they put the threshold of 0.65 of hazard ratio, which is a big gap, right? So that's one thing. But the concept is there and the difference is there specifically for specific subgroups of patients, such as PD-L1 negative, mutated, BRAF mutated melanomas, and patients with LDH of above the upper normal limit. And if you think about this, this is the group of the difficult patients to treat, meaning the patients that most likely will be resistant, right? So this is the group of patients that really we are interested about, the patient that we normally treat with anti-PD-1 plus and SOLI4. So I find these results, even though it's by definition a negative study, I find these results very compelling, specifically for this subgroup of patients.